How you doing, guys? Dermot from Resync Physio here. Okay, we're going to talk a little bit more about hip pain in males who play GAA. It's a big topic at the moment. Over the last number of years, Sanctuary Sports Clinic have been doing an awful lot of good research to trying to figure out the why behind males are getting hip pain and why they're always so tight, especially in a multi-directional field-based sport like GAA. So what we're going to go through today is what are the main points that you got to look at. How do I know if I have hip and groin pain? When should I go see somebody, and what can I do about it to try and help it around? So with the hip pain and you're playing a field-based sport, the biggest risk factor for when you're going to get that pain is a lack of extension through that hip. So if you're in that position, you're not able to extend that hip back without feeling any tightness in the front or without arching that lower back, what's going to happen is that joint is going to move differently. So if your back is staying level like that, but all of a sudden you arch your back like that, your pelvis is going to tilt. Now imagine you have a socket underneath that, that's your hip bone that sits into it like that, and you arch your back. The angle at which that hip bone is going to hit that acetabulum, it's going to change. So imagine you do that and you're running in middle positions and that's rocking in and out. It's going to break down at some point and start to give you pain. So all we want to do is we always want to recorrect a position back into that hip to make sure it's being loaded correctly. If it's not being loaded, you're going to run into trouble. The other problem is when people go to be able to change directions. So if they're changing from right to left, you'll see a lot of people, if they go to push off that right, they'll lean to the right a little bit too much because they don't have enough control. That knee is going to drop in that position and they're not going to be able to express force to come back out of that. So that's going to load it. Now think of many times you do that throughout a match. That's going to end up being a lot of time and then accumulate that over a couple of weeks, because you always see that groin pain, it started to niggle a little bit more, then it kind of went away, or you started to warm up and it started to feel a bit better and then you went through the game, but then you're in a fucking jock by the end of the match, or by the time you got home, or the next morning. And they're all classic signs. You can kind of go, right, you're inflaming something in there, it warms up, it feels a bit better, and then it's getting sore afterwards. Or you might feel that sharp pinch in that position when you're going to sit down. So what we tend to do when we look at that, when we look at males, is do they have the ability to stand on one leg? Do they have the ability to cut on one side? Do they have the ability to extend through that hip, but also not just extend through the hip, but try and lengthen through the front of that hip as well? So we're looking at different points of contact of what they can do. Also, we need to look at how they're able to rotate in that position. Are they able to control that leg as they land and rotate in that position? Because running is a rotational action. You never see anybody running with shoulders like that, not unless they're a fucking bodybuilder and they're trying to run and they're just shit at it. So what we have to do is we have to try and analyse what position that they're not strong in, that we're able to pull them back out of. And that can be a compensation through your knee, through your ankle, through your hip. Yes, the hip is the issue, but you have to look at everything working as a system to try and move it. And remember, when you're looking at a system, you look at front, back, side, and then synergists of muscles that work around it. So for instance, your lat comes down and comes right down into that lower lumbar fascia there, which protects that lower back. So a lot of people kind of go, all right, working your back muscle, working your glutes. Why not working your lats? That's a big, massive muscle that's going to protect it there as well. And generally, you'll see the strongest guys and the fastest guys are going to be the ones with the biggest lats, because they're able to do pull-ups. Now, pull-ups is another video that we're going to do later on. But ultimately, unless you get that lat locking down into that position, not pulling up into that position, locking down, then you're going to get a very, very fast athlete. So what we want to be able to do is assess whether they can move right or left. Can they rotate? Do they have the ability to extend through it and lengthen through the front? And then do they have the conditioning to actually maintain everything in a good position as you're doing it? So a nice good exercise that we can do for males with hip pain is just basically one leg down. If you're sitting in the car and you're commuting down to work, just raise those arms up and try and stretch back into that position. And what you'll start to feel is you start to feel the front of that hip loosen out. You start to feel your stomach start to loosen out. And then you start to feel your upper back loosen out, and then you start to feel your pecs being loose out into that position. The problem with the hip pain is you're all too far down in here, and you don't open up enough back into that position. In general, as you're getting a little bit older, you'll need to take a little bit more time to warm up. Do not just jump out of a car and jump into a training session. You need to take the time to warm up, and as you get better at warming up, then your body will be more prepped for the movement. Hope that helps, guys. Any questions regards to hip or groin pain in male GAA athletes, give me a shout.